Biggest challenges that we see with our dry eye patients are twofold. We've got the understanding on the patient's behalf that this is a chronic problem, one that will never completely go away. They don't understand, though, on the second hand, that we can treat them. The treatments are broad and immense now. 10 years ago, we didn't have these options. Many of our patients would come in and use artificial tears, and they would have picked those up on their own over the counter. That's all we could offer to them as well. Now we have options that go well beyond artificial tears. Artificial tears are a palliative type of treatment. And palliative treatments are ones where patients are treating on their own. It's a temporary sort of relief, and then the problem comes back. If we can now convince them that we have other options, medical options, that we can add in and make their eyes feel better, improve their visual acuity, we'll have a happier patient long term. Patients that are picking artificial tears up over the counter are basically self-treating. The self-treatment generally convinces the patient that there's not much more that their doctor can do for them. So it's an educational type of paradigm that we have to create. Convince the patient that there are options out there, and these options are broad, and that they are effective. Easy tears comes into play in my practice in a huge way. The ITF guidelines have 4 tiers that we use as far as how we treat our patients and how we diagnose them for dry eye. These patients now have a very high level of treatment that comes into play early in the ITF guidelines, meaning we can use omega-3s, in particular easy tears in my practice, to help address those early dry eye complaints and make the patient happier overall.